it runs from the L1, 2, 3, 4, 5 down over the front of the hip. So do you remember we felt down, just getting them to gently relax their abs and just above the inguinal ligament, and flex your hip against me. And you can just about feel it there. And then at the front of the hip joint, just below the inguinal ligament, you may feel the, push again, the hip flexor tendon or iliopsoas tendon, a little bit more lateral there. Go again. Yeah, there it is there. Okay. Rec fem. I usually get my knee under their knee. ASIS, 3 fingers down, 1 finger medial. Feel deep in there and press your knee down into mine and your foot up towards the ceiling. So, sorry. Hold that there. Don't let me push you down. And there's his rec fem origin. Relax. Rec fem muscle belly. Right down the middle of the thigh, and rec fem insertion. Okay? That one's fairly straightforward. Sartorius. Usually, yeah, like that. ASIS, come just down off the ASIS, and you can get them to flex their hip if you want. Push against me. Which will make that tendon stand up, but so will your hip, your rec fem, so will everything else. So quite often what I do is I get them to abduct out against me, and then the sartorius is the only one there at the front of the hip standing out because it's the only one abducts of those. Okay? Glute max on your belly. Bend your knee. And lift your knee off the bed. And there we have glute max working, and we can feel the whole origin and the insertion right out into there. Okay? So muscle belly, origin and insertion of glute max. Semimembranosus, semitendinosus and bicep femoris. Origin, right up on that ischial tuberosity, so getting them to push against us. If you're struggling to find that origin, turn on your side to face me, Oisin, for a second. And flex your hips up. And you can feel that origin a little better. Now bend your heel in towards your bum. You can feel it a little easier in hip flexion. Go back on your belly though.
What's that one?
That's the origin of all 3 hamstrings. Okay? They kind of all originate together up there. Muscle bellies and insertion tendons. Bicep femoris insertion tendon. Semitendinosus is the more superficial one. Semimembranosus is deeper. Muscle bellies. Semimembranosus and tendinosus. Bicep femoris. Okay? Adductor magnus, adductor longus, adductor brevis. On your back, please. To here. Origin right up onto the pubic bone if you want to. When we're treating it, we would be feeling right up to there. So that's adductor longus and brevis kind of together there. If you want to pull your knee in across against me, you can see the muscle belly better. Brevis stops about here, longus stops about here. And magnus, if we get you on your side, doesn't matter which side. Flex the top leg up out of the way. Straighten the bottom leg. Bend up the top leg. There you go. Adductor tubercle here. And now lift this bottom leg off the bed. And there's adductor magnus. Ooh, sorry. Daddy, will I answer it? Adductor magnus there, okay? Where are we? Gracilis. Come down the end of the bed here. Gracilis is the one that crosses the knee, so it assists in knee flexion. Once your knee flexes a little bit, it can then assist. Drop back on your elbows. So we can use that knowledge that it's the only one of those adductor ones that flexes the knee. So feeling on the midline of the thigh where the seam of your trousers would be, and just get them to bend their knee against you. So you pull your heel back for me. And there it is there. Okay? It's quite a small little band of muscle. Okay? Glute medius and tensor fascia lata on your side facing away from me. Shuffle to the bed abduct your leg up to the side. If I'm on ASIS, on the lateral aspect of it, especially if I get him to medially rotate with his abduction, I'll feel, you can even see it there, TFL, big ropey muscle off the side of the ASIS down to where the ITB goes over the greater trochanter. Now if you turn your toes towards the ceiling and extend a little, I get more glute med activity, okay? So glute med is further back into the side of the hip. So TFL, glute med. TFL we tend to feel more if we medially rotate with our abduction. Glute med we feel more if we externally rotate with our abduction. Now glute med does have some fibres that medially rotate as well, but the whole posterior portion externally rotates, okay? Piriformis, stay as you are, flex up your top leg. Actually, I might get you to turn over to face me, sorry. You would do this from behind them, but just so you guys can see. Flex up your top leg, rest down. That's that there. Okay, so flex their hip up. Find the greater trochanter, the top of the greater trochanter, or superior aspect. Find your PSIS and use that to guide you onto your sacral angle. Now I've got my sacral angle and the top of my greater trochanter, so now I know my piriformis has to be in there along that line. So if I just probe in there, I should feel just the ropey band, especially when you come out across to this portion, the lateral third of it. You should feel it as a nice tight ropey band just into the back of the hip, okay? Popliteus on your belly. This one is in the middle of the back of the, well, it comes from laterally on the back of the femur and goes to there. We can feel it just maybe fractionally lateral to the middle. Now, we can get him to flex his knee, push against me, and I do feel it working there, but also working will be all my hamstrings and everything, so if I want to isolate it a little bit more, don't let me turn your, sorry, you keep your foot there. Don't let me turn your foot out. And I can feel it working when I do resisted lateral rotation, okay? No, resisted medial rotation, sorry. Because it, yeah, it medially rotates the tibia, okay? Vastus lateralis, vastus medialis. And do you want to sit on the edge of the bed, facing that way? Push up against me. Here we have vastus lateralis, where it appears from underneath the ITB, and it inserts down into the lateral patella, okay? And vastus medialis, coming more medially, especially this oblique portion here, we can see coming right down and inserting into the medial aspect of the patella. And then, of course, we had our rec fem down through the middle. Deep to that, there's intermedius, but we don't palpate that because the other ones, okay? Gastrocnemius, if you want to stand over here, you can use the bed for balance and just go up on your toes. Origin on the medial side, crossing up over off the back of the femur. Lateral head off the lateral, a little further around on the lateral aspect of the back of the femur. Medial head or belly of gastroc. Lateral head or belly of gastroc, insertion down into the calcaneus. Okay? Soleus, I'd say, is next on the list, is it? Yeah. So can I borrow that chair for 1 sec? Switch that down there for a second. Use this one. Plantar flex, and then we see soleus deep to gastroc, and we can feel it down into the Achilles as well. Okay? So getting him to plantar flex in that position or down on your belly. We can do it in this position too. Push up against me so I can see soleus here, deep to gastroc there. Okay? Tibialis posterior, flexor digitorum longus, flexor hallucis longus. These are our Tom, Dick and Harry. If you lie on your side, stay on your side, facing that way. I'm just going to take this bottom sock off. Come down a little further. Okay. Now, I'm just going to do the Tom, Dick and Harry tendons first. Tom, Dick and Harry tendons behind the medial malleolus, perineal tendons behind the lateral malleolus. Remember that, okay? So just get him into a position of inversion. You keep your foot there. Don't let me push you down. There's his tibialis posterior tendon, right over the medial malleolus, and relax. And we should feel, if we find his shin and come posterior to it, and press up against me now, I should feel his muscle belly of tibialis posterior. What's the next one then back? Flexor digitorum. So I'm going to get him to curl his 4 toes down against me. And there's flexor digitorum and flexor hallucis right there. I can really feel that one just there. Okay? So flexor digitorum, curl the 4 toes. Flexor hallucis, curl the big toe down against you. That's the insertion tendons. Yeah, that's all we did really. Okay. Peronei, over on your side. Oh, I should just swap legs. It's just as easy. Keep your foot in that position. Don't let me push you down. Peroneus longus, muscle belly, up in the upper third. Peroneus brevis, down in the mid and lower third of the lateral fibula. Tendons, here wrapping behind the lateral malleolus, behind the perineal tubercle. And then the little brevis goes into the base of the 5th metatarsal, and the longus goes underneath the cuboid to sling under the foot. Okay? So tendons and muscle bellies. Okay? Peronei, extensor hallucis, extensor digitorum, and tibialis anterior on your back. Now, you pull your foot up towards you, keep it there. Now, starting with the tendons here at the ankle. The most medial one of the 3 at the front here is tibialis anterior. It's the big, strong one, comes down into the cuneiform, doesn't it? Okay. Right next to that and sharing a sheath, we have, just pull your big toe against me, we have extensor hallucis longus. Okay, and then a little further over on the other side of the talar dome, let's say, pull your 4 toes, you can see the 4 tendons and then the 1 big tendon at the front of the ankle there. That's extensor digitorum longus. Muscle bellies, we can kind of feel them up along here. Extensor hallucis comes from a little bit more over on the fibula. Relax. It comes off the front of the fibula, yeah. And tibialis anterior, pull your whole foot against me. Muscle belly is here. It's that big fleshy muscle just lateral to the tibia. Okay? Where are we? Patellar tendon and ligamentum patellae. So it's just that there. Okay, you can make it work a bit more there. The ligamentum patellae. Okay? I think that's pretty much all we did, isn't it? All right. Happy?